We'll start in like 3 minutes. Let people join in. Am I audible?
Yes, ma'am, you are audible.
Okay, great. Is Swati there? I think we'll start in in a minute. Hi everyone, good evening, good morning from I'm in New York right now, and I think most of the people are joining from India. So the way we will do this webinar is Swati, I'll introduce Swati, but it's going to be very interactive. I'm going to ask questions on your behalf. So whatever questions you have, please put it in the chat box and I'm going to ask her. And let me start introducing how and what we are going to do in this webinar. So today we are obviously talking about insulin resistance, which is the root cause. And I just want to state some just new findings about insulin resistance with uh, scientific evidence. This is one thing which was that recent research which indicated that insulin resistant individuals in these individuals the glucose uptake by skeleton muscle is diminished due to the impaired GLUT4 translocation. That means GLUT4 is a protein is It helps in absorbing the fat and proteins into the muscle. So if that is low, the GLUT4 is impaired due to insulin resistance, your muscle mass obviously decreases. Also, the skeleton system is affected. The other one was about inflammation. Now, chronic low grade inflammation activates the pathways such as J&K and NF-kB, leading to disrupted insulin signaling and contributing to insulin resistance. So, inflammation and insulin resistance have a very, very strong correlation, and we're going to discuss about it. But these are the new findings. And one thing was, of course, the type 2 diabetes. The longitudinal studies have demonstrated that insulin resistance often precedes the onset of type 2 diabetes by several years. That means for us, for functional nutritions or with functional practices, what we've noticed is that first you get insulin resistance, then you get prediabetes, and then you get diabetes. So it's a series, and we're again going to discuss and deep dive into it today. So let me introduce Swati online now.
Yeah, yeah. Hi, I'm here.
Hi, Swati. Okay, let me introduce Swati to you. Swati is a leading naturopath physician, plus she's a head nutritionist. She's been working with Awaana, and she's excellent with handling such cases. We've been handling very, very strong cases with cancer and hormonal imbalances, fertility, uh, heart diseases, cardiovascular problems. Since I'm also working here in US with people, the issues are like the larger the country, I feel the larger the issues. So yes, we have really reversed a lot of people's issues, and the missing link, the link was actually insulin resistance, and that's how we wanted to really throw light on this topic because it's really important. The older people are getting affected, even the children are getting affected. It affects from people who are even like in your in vitro. The mother gets insulin resistance, and so that the children also get insulin resistance. So it's very important to discuss. It doesn't matter you're thin, you're fat, or what, but insulin resistance can affect anyone. Let's get to the next slide. So I will hand over the webinar to Swati. And Swati, let's first discuss the signs of insulin resistance because people don't know what's happening. Why should they be concerned about this? And what are the signs physically we can look for insulin resistance if somebody is new and joining and doesn't know about this? Let's
Right,
get to the basics.
right. Hi, and good evening, everyone. I'm Dr. Swati. So, okay, we are talking about insulin resistance. So, let's do an exercise first. You can see a list of signs in front of your screen. So, I would urge everyone to note down if you have any of these conditions: abdominal obesity, that means excessive waist circumference area. If you feel there is a lot of bulge in your abdominal area, difficulty losing weight, if you have been struggling with one, cravings for sugar, or do you crave rice or any kind of carbohydrates all the time? If you have been diagnosed with any grade of fatty liver, do you feel chronic fatigue, or do you feel lack of energy in yourself, brain fog, you're not able to mentally be sound? If you have been diagnosed with high blood sugar levels, or do you have skin tags on your skin anywhere on the neck or anywhere in the body?
What is skin tags, Swati? I think you might.
Yeah, so skin tag is like the black, raised bumps on the skin. If you can feel black raised bumps on the skin, and it is usually present around the neck area. If you have any degree of insulin resistance, we will be showing a picture of this, and plus the patches, dark patches, it comes together mostly. So if you have any kind of dark patches around the nape of the neck or anywhere in the body, you can note down that. If you have been noticing high blood pressure, frequent urination, or you feel thirsty all the time. So please note down the number of symptoms or condition you have at present, or anybody in your family or anybody in your friends. You can help them as well. This webinar is also an educational one. You can help them probably.
Absolutely. And you could also rate yourself, right? Like if there are certain things which you are low on, like you can give yourself a number from 1 to 10, and then let's discuss by the end of the webinar what it entails and what we can do about all these things.
Right. So can I have the number in the chat box? Anybody who have noted down the number? How many list of number have you felt? Can we have the number in the chat box, please?
People are still joining.
Yeah. Okay, so we can do this exercise even one more time at last. All right, we'll go next. So let us try to now understand what metabolic diseases are, how it is connected with insulin resistance, what insulin is, and why everybody is so putting so much of energy on understanding treating insulin resistance, why it is so much important. We'll go to next slide, please. Okay. So this is a crucial, step to understand what diseases are present, why it happens, what are the root causes. So you see in front of you, it is a tree. It's a tree. It has its branches. It has roots. So the roots, where the roots are placed, you can see number of conditions, number of causes of insulin resistance and metabolic illnesses. So whatever disease surfaces, whatever symptoms are shown on the body, whatever signs you can see in your body, there are always root causes associated with it. And in fact, there are more root causes than the symptoms and signs, mostly. So if you are having diabetes, infertility, any kind of autoimmune disorders, weight gain issues, PCOD, PCOS, hormonal imbalances, or any kind of mental illnesses like anxiety, depression, you can you can just understand with the root causes why it is happening. Once we are able to identify the root cause, it is like a half battle won. So if the root cause is identified, and it can be different with everybody, one person might be having a root cause of poor diet or nutritional deficiencies, other might be suffering with a lot of stress in their uh, environment. There might be a cause of liver and gut problems where the liver and gut is not aligned and having toxins a lot. Even that can lead to some metabolic disorders.
So, Swati, I have a question. How about we've seen in our clients a lot of people actually onset of cancers or even PCOD, you said, has insulin resistance. It's the basic cause is insulin resistance.
Yeah,
So,
right.
so what is the main root cause for insulin resistance to happen? Is that a diet thing, or is it inflammation, or is it more endocrine disruptors?
Okay, so what happens, the more complicated a condition is, the more simpler it looks from outside. For example, weight gain. Somebody is obese, suffering with obesity. It might look very simple. Array, this person might cut down on carbs or cut down on sugar. He or she might become lean. What is the problem? So insulin resistance is such that it may look very simple. Ki, okay, you can cut down just the sugars because the insulin is rising. It is leading to high blood sugar levels. What is the problem? Just cut down on sugar and your life will be easy. You will be reversing your condition and it's all set. But it's not so. Insulin resistance can have multiple and various factors, and it could be associated at different intensity with different people. For example, if I suffer with it, for me, it might be, as I said, it might be inflammation, which is leading to insulin resistance. And for other person, it might be something else, sedentary lifestyle or a certain kind of infection which has triggered it. So we cannot really, generally say that insulin resistance has this one, two, three causes.
Right, Right. And I remember because I was quite insulin resistant before I was diagnosed with cancer. How now I understand, because PCOD was one condition. But what you were mentioning about brain fog and lower energy levels, and all of a sudden you get these low dips and high dips and low dips and high dips. And now I understand, of course, I had insulin resistance, and one of the main factors of different types of cancer is also insulin resistance, which we know now have very strong evidence of it. So let's get on to the next slide, and we can get more into what happens. Why do people get insulin resistance?
Right. Okay. Okay, so these are the pictures of acanthosis nigricans. What I was talking about, the dark patches. If you have dark skin patches, around the neck of the area, it is called acanthosis nigricans. It is a sign, classic sign of insulin resistance developing to a moderate level in your body. And of course, obesity or excessive fat in your body, it is both a cause and a sign of insulin resistance. Next slide, please. Okay, so metabolism means how energy is processed in your body, how energy is broken down, consumed by your cells. So,
Yes.
metabolic disorders, in simple terms, it just means energy imbalance, some kind of energy imbalance. Either the energy is not created at an optimal level, or either the energy is not delivered to your cells at an optimal level. Simple. Okay, we'll go to the next slide. All right, so now let us begin with the crucial topic we are all here today for: insulin resistance. So, what is insulin first? If you look at this picture, this will give you a very good understanding of what insulin resistance exactly is. So, if you see with normal insulin metabolism, what is happening is you are eating something, whatever you are eating, carbs or any food that you are eating, it converts into energy, which is glucose. Glucose, whenever glucose is released in your blood, insulin is secreted from the pancreas. Pancreas secretes insulin, and insulin's main role is to take this glucose or this energy to all the cells in your body so that your cells can utilize this energy to do their different functions. Liver, heart, kidneys, everybody have their own task. So ग्लूकोज इज इंसुलिन इज व्हाट, अ मीडिएटर, अट्रैक्टर, कि लो भाई ये हमने तुम्हें ग्लूकोज ला दिया, इंसुलिन ने ग्लूकोज ला दिया, नाउ डू योर वर्क, right? Now what happens in insulin resistant condition is the, if you see this margin, the cellular margin, the border of it gets damaged. So it is something called as receptor damage. The receptor which activates insulin, or which helps the insulin to get inside the cells, it gets disturbed. So basically what is happening here is your cells are becoming resistant towards usage of insulin. They are not recognizing the insulin anymore, that we don't know you, we will not let you work here. So now what will happen? Eating as usual you're doing, glucose will eventually get secreted because the digestion happens. After digestion, the glucose gets secreted in your bloodstream. Now insulin is also getting secreted. Yahan tak theek hai, normal. When insulin is getting secreted, now your cells are not recognizing your insulin. It is rejecting the insulin activation. It is rejecting the insulin functioning. So now what happening, if you can see in the next picture, second picture, first wale mein, there was normal glucose level inside the cell because insulin sends this glucose to the cells. But in right side, there is lack of glucose inside the cell, but too much of sugar or glucose in the bloodstream. So the sugar which is supposed to get into your cells, get to work, it's not happening, and it is just lying ideally in the bloodstream, which is a classic diabetic condition. Okay, we'll go to the next slide. This is clear, everybody, because this is crucial to understand. I tried to
I
make it.
think it's like, for very simple people, for simple explanation, it's like डोरमैन आपके सेल्स के अंदर एक डोर है. वो डोर जब थोड़ा सा जब खुलता है तो इंसुलिन अंदर, यू कैन सी द इंसुलिन कमिंग इन. बट when your cells are like overdone with it, The insulin will come with the glucose and start knocking, and your cells stop recognizing.
Right.
They go deaf, and
Absolutely.
they don't let the insulin and the glucose enter because there is already so much for you to consume. And
Right.
that's where the issue comes. So I hope everybody understood this and has a little bit of sense of what is happening. And obviously, if you have any questions, you can put it in the chat box, and I can obviously ask Swati, or we can do it at the end. But I hope this was a simple explanation for all of you to understand. Okay, let's discuss the vicious cycle of insulin resistance.
Yeah. So this is also an interesting mechanism which happens in insulin resistance. Now you all know what insulin resistance is. Now once insulin resistance is developed, this cycle keeps on going unless you address it or reverse it. So this cycle, if you see this man eating, what happens with insulin resistance? You will eat, blood sugar will go up, pancreas will secrete the insulin, pancreas will secrete more insulin because you are eating more. Okay. Now, as we know, cells will resist insulin in case of insulin resistance. The moment cells resist insulin, cells will also struggle to produce enough energy because they don't have that glucose. Now, in response to less sugar or less energy within the cells, even more insulin is secreted because it sends a signal to your brain that there is no enough glucose, there is no enough energy in the system. But what your brain wants is to send energy to the system, which is crucial, which is essential part. So, in response to low sugar, more insulin is secreted from your pancreas. And when there is so much of insulin, free insulin rotating in your bloodstream, it leads to inflammation. We will also understand the connection between these two. It leads to inflammation, and inflammation again triggers more insulin resistance, again triggers your cells to be more resistant towards the insulin sensitivity. And then eventually, because you are not having that much energy, you will end up eating more. You end up eating more. There is so much of glucose. Again, pancreas will secrete more insulin. So this cycle just goes on. It keeps happening.
I think Shubhangi is disconnected. Okay, any questions so far? Anybody? How many of you think that you have insulin resistance? You can raise your hands. You can tell yes, no in the chat box. There's so many of y'all have joined. Let's be more interactive. You can ask any questions if you have, or share it with me privately. It's okay.
Or we can do it at last. We can do a Q&A all together at last.
Yeah. Okay.
All right. So we will now try to understand the pathophysiology, means the relationship between cause, effect, and functioning of insulin resistance. So this is again a little complicated, but very interesting sector. Please be attentive and please ask your question for this specific section here now itself because it is something important to understand. All right. So, as we discussed before, there is no one cause to insulin resistance. There are multiple factors functioning in your body. There are multiple causes, and they work in connection with each other. There are cycles going on, there are connections going on, and each and every system, each and every organ in your body behaves differently with insulin resistance. So, we will try to understand how your gut is connected with insulin resistance. If you see this picture of your colon and small intestine, this represents your gut. So this picture looks complicated. I'll simplify it for you. What happens with insulin resistance
Full
is,
screen the size. So, Shivangi, just full screen the size.
Ma'am, I will trying my side. Actually, Swati ma'am is sharing now.
Okay.
yeah. Okay, so this picture of colon, what happens in insulin resistance is your gut dysbiosis, microbial dysbiosis also takes place. Dysbiosis is nothing but an imbalance in your good and bad bacteria in the gut. आपके gut में अच्छे bacteria भी होते हैं, खराब bacteria भी होते हैं. Bad bacteria are always present in your gut. No medicine, nothing can completely destroy them. And it is crucial, it is good to have a perfect balance of good and bad bacteria both. The role of good bacteria is to kill and control these bad bacterial colony so that it is not rising up after a certain level. Okay, so what happens with insulin resistance and inflammation? We understood कि inflammation जब होता है, so it leads to insulin resistance. Insulin resistance will keep accelerating the inflammation process. So when inflammation or insulin resistance, any of this is present, it also affects your gut microbiota, the imbalance in good and bad bacteria in your gut. Now, when this happens, it leads to a condition known as leaky gut syndrome. Leaky gut simply means that the particles or the molecules which are not supposed to cross your gut barriers. See, if you see this second picture, this one, this is a lining in your gut. So there are these villi which is supposed to protect your gut so that only the essential nutrients or the good things pass through your gut and rest all gets defecated out, waste matter out. Now, in leaky gut syndrome or when the dysbiosis happens, this barrier also get affected and the molecules which are not supposed to cross the gut lining crosses the lining and gets into the main bloodstream. Whenever any foreign antigen, any foreign molecules gets into your main bloodstream, it triggers inflammation directly. Inflammation is nothing but your body's defense mechanism जहाँ एंटीबॉडीज प्रिपेयर होते हैं एंटीबॉडीज रिलीज होती हैं आपके ब्लड में सो दैट इट कैन फाइट विद द फॉरेन एंटीजेंस एंड इन्फेक्टिव एजेंट्स. So when this condition will happen, it will provoke inflammation, and inflammation again triggers insulin resistance. Because inflammation जब होता है, so there are number of chemicals reactors going on in the body, which actually just impairs the insulin signaling pathways. And again, this will be a vicious cycle. The arrow should also go up because it will eventually further aggravate the dysbiosis in your gut. So this is clear. Gut microbiota gets affected with insulin resistance, leads to inflammation, and inflammation further accelerates the same process. So this is the
So,
connection with your gut
yeah.
microbiota.
So Swati, what in for the people to understand, like you mentioned, good bacteria and bad bacteria, how will they know whether they have good bacteria or bad bacteria? What are the two, three signs, symptoms physically? I know gut testing is one way, which if you want to really deep dive into understanding which
Yes.
bacteria you have, and we
Yeah.
could also understand whether you have candida or not. But
Yeah.
for people to understand whether they have the good or bad bacteria, what are the things they can
Yeah. So
start
gut
doing?
crucial,
Right.
as you correctly said, there are tests can also be done to understand the good and bad bacterial growth, if it is in balance or not. And those are pretty advanced tests. Everybody does not do it on a regular basis. But yes, there are certain symptoms which we can look for. For example, bloating looks very simple, but it could be one of the cause that your microbiota is hampered. You might have indigestion, you might feel constipated, you might feel that you are not mentally that much equipped now to take decisions to deliver everything because brain fog, as we discussed earlier, that also takes place when your gut health is not maintained.
Yeah.
You might have unwanted or erratic cramps or pain in your body, which you might have very good muscular and bone health, but you might develop certain kind of pain. You can get headaches, and headaches might have no reason,
Right.
and you
Right.
can feel lethargic, you can feel tired. So gut health is so crucial that you can have n number of symptoms and which might go undiagnosed for years together. We have seen, Shrutiji, that people go undiagnosed for years
Yes.
together and the only thing which was impaired was their gut health. That's it.
Yes. That's true. I
So
completely agree with you. Yeah.
everything, good exercise, everything they were doing.
Yeah. And people often, the doctors also are not able to understand most of the cases, what's happening. And we've seen miracles when we function with the gut health, everything gets starts to get better. Okay, this is also an important slide. Yes.
Yeah. So we have understood the connection of insulin resistance with gut health. These three organs in the body, on top, what you see right side is the adipose tissues, means your fat cells. Right down is the muscle cell, and left is the liver. We all can recognize liver. So when insulin resistance affect or is generated in your body, these three organs are primarily either affected or they just accelerates the entire process. Let us understand with the fat cells what is happening. Gut, we have understood what is happening with it. Now with fat cells what happens is, फैट सेल्स का प्राइमरी फंक्शन है फैट को स्टोर करना. सिंपल. फैट सेल्स बने इसलिए है बॉडी में, सो दैट दे कैन स्टोर दी fat in your body for emergency purpose. Whenever you are fasting, you're not able to eat, and your body needs energy, it will deliver the energy from fat metabolism. Now, in fats, what will happen when insulin resistance develops in fat cells? When insulin resistance develops in fat cells, then this storage of fat gets hampered, and reverse or opposite mechanism triggers, which is lipolysis. Lipolysis means the breakdown of fats. So breakdown of fats happens, and it also releases free fatty acids or triglycerides in your male bloodstream. Why it is happening? Because if we can recall the earlier slides, your cells are not able to function because of lack of energy. So lack of energy में ये mechanism trigger हो जाता है that fats just releases the free fatty acids in response to कि energy is not present. Let's break down fat for energy purposes. So when fats, जब fats का वो काम है नहीं कि हर बार वो energy supply करे, but when it becomes a consistent process, तो free fatty acids get secreted in your main bloodstream, triglycerides secrete होता है, and many of us might have seen कि हमारे reports में triglycerides high आते हैं, LDLs बहुत ज़्यादा quantity में amount में show होते हैं. So this might happen because your fat cells are now insulin resistant. Okay. Now
Any
in
questions in the fat cells thing? You can ask. Okay, there's one query. Okay, let's go ahead and then we can ask.
Okay, so now what is happening in muscles? Muscles का काम है to take up the energy. See, muscles, if your muscles are in a very good hale and hardy condition, then your muscles take up the maximum energy, maximum glucose, because they have to work a lot. You are walking, talking, anything, any function, any function which is happening in the body, happening because of the muscles. So muscles are the primary consumers of glucose. But when it becomes insulin resistance, what happens in muscles is there is a reduced glucose uptake. That means the glucose which muscles are supposed to take in, it is not going inside the muscle cells now. Okay, so muscles will eventually be losing its status, and you might feel that there is pain or there is you are losing muscles. Some people they try to lose weight, but they end up eventually losing muscle mass rather than the fat mass. Fat stays as it is, nicely sitting in the body. Okay, so now when the muscles are not able to take up this sugars or this energy, it also get directed to liver. Now यहाँ liver का जो presence और function है वो समझना भी important है. See, liver act like your mother here in this entire process, because whatever in our family, whatever the kids are not eating, the husbands are not eating, especially this happens in Indian scenario. If foreigners are there, they might not be able to understand, but Indians know this. So whatever the food is left, overnight, mother will think, okay, let me eat this. Why waste? Let me consume it. So liver act as a mother here. So sugar, muscles are not able to consume. Adipose cells, fat cells not able to consume because of insulin resistance. Now the liver will think, okay, why waste the sugar? Because if I waste the sugar, or if I also transmit the sugar further, it will eventually go to bloodstream, and this will lead to diabetes. So this process primarily liver want to protect. So what will happen? Sugar unused from muscle cells goes to liver. Sugar unused from fat cells goes to liver, and liver is not equipped to use so much of sugar. What it will do? It will just convert this entire sugar into fats. Fatty liver disease, non-alcoholic fatty liver disease develops. If anybody has fatty liver, they might be knowing कि उन्होंने कहीं ना कहीं ये concept सुना होगा. Yeah. So eventually what happens? Liver gets stores, keeps storing sugar, and a time comes when fatty liver disease eventually develops, which means कि liver में liver cells के अंदर fat का deposition बहुत ज़्यादा हो गया है, and this fat deposition will eventually just diminishing the liver health. और लिवर के जो प्राइमरी फंक्शंस है, दैट इज टू डिटॉक्सिफाई योर लिवर, क्रिएट बाइल ज्यूस एंड डू मेनी अदर फंक्शंस फॉर द बॉडी, इट विल get hampered. Okay, so this is
Yeah, it was very well explained. If you have any questions, please, you can come on the screen or ask in your chat box. I think even the fatty liver thing before, we've seen in a lot of in the liver profiles, liver enzymes also get elevated, and people start just putting on weight. And people don't understand primarily that the liver also is like overworking in that scenario. If your liver is overworking and it's not getting rest, I mean, and liver works even if you're sleeping and stuff. And if it's just metabolizing fat again and again and again and again, that condition also leads to obesity, and which is one of the most common factors now in India and all around, even in US. And we've seen elevated levels of liver enzymes or any kind of other elevation in the liver, sluggishness in your day-to-day routine. Even that is one sign of fatty liver, getting to the fatty liver. So if you think that your energies are dipping throughout the day, or you're feeling very sluggish, like you have to drag yourself and you can't wait to just get to the bed, that means your body functions are just overworking. The function of humans, like from the morning, we should get up from the first sunlight hits the earth. Our body should just immediately get up. If you've seen an animal, but now obviously with our circadian rhythm getting impaired due to various factors, we get up late, we eat late, we sleep late, so all of that also gets into way of your liver functions, your even getting insulin resistance and so many other things, dysbiosis, gut health. So this is very important for you to understand, and that's why we are going deep dive into you getting an knowledge about what's happening inside your body. So if you have any other questions, please tell us. If you want privately chat, do let us know. Okay, let's get to the next slide because I think we have a lot to cover. Yeah.
right. Okay, so this I will just run through because we have already discussed a lot of it. What happens in skeletal muscle, adipose cells, and liver. So I just want to explain one more mechanism here. If you look at the bottom of the slide, systemic insulin resistance and inflammation is mentioned. When all of these organs, your muscles, your fat cells, your liver, your gut health, everything, all of them are affected with insulin resistance, they all become insulin resistance. Then your hypothalamus present in the brain eventually develops insulin resistance, and when that insulin resistance develops, it leads to systemic insulin resistance. That means every single cell now in your body is insulin resistance. So when
Oh,
all of
wow.
these three are insulin resistance, this is the last stage. After this, only your brain will develop insulin resistance. Systemic insulin resistance means a generalized one. Yeah. And there one mechanism also happens, leptin, which is a hormone. Leptin का काम होता है आपको खाने से रोकना. खाने से रोकना as in when you're full, leptin hormone gets secreted and it sends a signal to your brain that we are full, we don't want food now. When your brain develops insulin resistance, then this hormone doesn't work, and even if you eat 10 people's food, you will not feel full. So we have seen cases that people keep just eating, and eating disorders we all know. is on rise because the leptin is not functioning properly or not getting produced, and brain has developed insulin resistance. When systemic insulin resistance develops, guys, it becomes really, really, really next very difficult to reverse it. Very, it is something a last phase, and it happen in years. It doesn't happen in over weeks or months. Happens in years.
Right. And we've seen people, even with children having developing, they just
Children,
can't stop
they develop
eating
diet.
that bag of chips, which happens, and they just want to eat every time, all the time. So, guys, if you have anything going on in your family, when your children, they need food. Like we've seen, there was a case who it's like she was so hungry all the time. So if that's the case, there is, of course, this is like a pathway to insulin resistance. Yes.
Okay, so we can see lot of list. The list is huge. These are the diseases which where insulin resistance could be the primary cause, or where the disease actually began with insulin resistance and led to somewhere. It could be cancer, it could be diabetes, hypoglycemia, heart stroke, high blood pressure, insomnia, depression, PCOD. This is a huge list, guys. So insulin resistance is a thing which has to be taken seriously. Anybody who is at mild or moderate stage should take it seriously and should work on reversing it to prevent all these conditions. Okay. So, this is a list of so many factors which can contribute or which can lead to insulin resistance. For example, inflammation. We spoke about inflammation, how it is connected. Gut dysbiosis, we know about. Sleep and stress can also lead to insulin resistance or contribute to it, because when you are lacking, when you have a lack of sleep for over months or years, not for few days, when you're partying and all, when you have it for months or years, then there is a rise in cortisol level, which is stress hormone, and it triggers inflammation in the body, and inflammation again will lead to insulin resistance. Hormonal imbalances can lead to insulin resistance, and insulin resistance can further aggravate or lead to hormonal imbalances. This also is a vicious cycle. Heavy metal toxicity. When it comes to toxicity, if your body is having too much of heavy metals in it, then that can create inflammation, that can disturb your cellular functioning, your brain functioning, and further lead to insulin resistance.
And you can easily check your heavy metal. There are blood tests, there is hair analysis, there are a lot of other
Mhm.
testing protocols which you can understand. And I think everybody should do this test because heavy metals is serious. It's something which and it takes years sometimes to get the metals out of the body, especially. So I had gone through chemo and I knew that I had heavy metals, and that obviously my test showed. And it took quite some time for me to get rid of the mercury and everything. And there's a lot of mercury in the brain with children because the environment has heavy metal. So if you do want to do this test, it's now quite easy to do it, and everybody should do this test.
Right. So these are some tests which can be done if you suspect insulin resistance. We usually do fasting insulin test at the beginner level because it gives a fair idea about if there is insulin resistance developing or not. So high triglycerides and increased fasting insulin or fasting sugar also. These two, three tests gives a fair idea, good idea about the insulin resistance, and other ones are the advanced tests. Okay, so this is our approach to deal with insulin resistance, and it is a complete drugless form of modality. Functional assessment we do to understand the nutritional deficiencies, because nutritional deficiencies many times it triggers the inflammation and it prevents the organ to function in a fair manner. Naturopathy, it's also a modality where drugless form of medicine is practiced, and a lot of herbal usage, lot of lifestyle modifications can be done. So when we combine both of these modalities, it gives a very good result without any use of drugs, without any use of medicines. So Yeah, so 5 hour rule for insulin resistance. And most of the people, if they follow just these 5 rules, we have seen reversing the insulin resistance, replenish, that means correcting nutritional deficiencies, removing the toxins, and having stress-free life, balancing the hormones, and of course, stress management is very, very crucial again.
I think this is a very crucial step for not just dealing with it temporary, but overall, if you really want to live a healthy, long, and quality life, you should focus on the hours which we have discussed. Because remember, there is no shortcut in health. You think fat diets, I'll just do a diet for 3 months and that's over. No, I mean, I have insulin resistance for sure, and I have to really make sure that I'm not going to that path again and again. So you have to make sure that whatever you do, whatever path you choose, it should be sustainable. It should have good effects. Yeah, it's replenish. That means first of all, you need to assess, okay, what assessment, how will you do it? According to your blood, you can obviously do a good analysis of blood, and everybody should do it. First, understand the nutritional deficiencies because most of the people are really deficient in vitamin B vitamins, vitamin D, magnesium. Three, four things which I would suggest you should just go and get your nutritional deficiency test, get that done. Removing toxicity, as we said, liver and gut, extremely two important organs which everybody should think about because these are like our main organs where the food gets digested and it also the toxins and the liver processes all the toxins. Eliminating estrogen mimickers, that means like for example plastic is an estrogen mimicker, or eating foods which have like extreme dairy which is not which you think is coming from a dairy and not like a farm. If you are thinking A2 milk or something, I don't know about, I'm a vegan, I don't drink dairy, but we've seen the estrogen are on a rise, like that's why most of the cancers also happen. And reassure, having faith in yourself first of all, that okay, whatever you're doing, if you're choosing a natural path, it takes time. Holistic health, the way we do and way we really tell people is that listen, you're going to take small step towards better health. Nothing is easy, and but the results, if you go slowly and keep changing, it takes years for your body to have certain condition and to give you, like even fat, even if somebody is overweight, it just doesn't start overnight. It takes years for that fat to accumulate. So you have to have faith that whatever you are choosing, and have patience with yourself. Most importantly, we are in a hurry. We want instant validation, we want this, and all of a sudden we want good health in matter of 3 months. That doesn't happen. Anybody who's telling okay, you'll get better, you'll just lose fat and you'll be good in 3 months, just stay away from it. Rewire, again, this is a neuroendocrine pathway and metabolism. You have to understand the pathways and the metabolism, your metabolism. It's very bio individual. Stress management, extremely again important. Sleep, stress management, connecting with yourself, just spending some time and asking relevant questions about your life, extremely important. Great. So these are the signs with your healing where you slowly start, like we've seen people slowly getting their energy levels getting back, headaches start getting slowly down and down and down, and maybe they could have triggers, but the improved quality sleep, regular flow of periods, that's important. If somebody has insulin resistance and they have PCOD and PCOS and their periods are getting affected, the skin improves. That's really a great sign of healing. If you start glowing, or you start seeing some sort of relief. If you have acne and insulin resistance is also very, very related. You're getting in tune with your body. That means you know what to eat, what not to eat. You suddenly understand Oh, I'm not craving sugars. That's what reduce cravings of sugars or starchy food and all, because the body is getting what it needs. Less bloating, improved bowel movements if you have constipation, and less puffy and inflamed. You don't have so much of inflammation and puffiness when you get up in the morning. Yes, Swati.
Okay.
So these are some herbs, yeah. There's a
Yeah.
beautiful slide, yeah.
So we have made a bunch of herbs, this document. So if you can see here, these are the things which are available in our kitchen. Okay, when it comes to fenugreek, turmeric, ginger, cinnamon, garlic, they helps a lot in reversing insulin resistance or preventing insulin resistance also. So even if you doesn't have insulin resistance, try to include these herbs in your almost daily life in your kitchen. You can add it in your meals. Parsley, cumin, oregano, yes, you can include these in your meals as well. You can make soups, you can make curries with this, and it tastes very good when you add a lot of spices in your meals. Bitter gourd, we all know, see since ages that it helps a lot in reducing blood sugar level, hence helping with insulin resistance. So diet is something which has to be customized for every individual because different kind of causes needs different kind of approach. But if you have some concerns, you can note down these or take a screenshot of this slide. This will possibly help you in a moderate level, at least if not completely.
Well, anyways, going to share this recording. But Swati, what about ACV? A lot of people have started taking apple cider vinegar.
See, apple cider vinegar has got medicinal value, has got effect on your body, but blindly taking apple cider vinegar only to reduce fat in the body or maybe to achieve your desired weight, it doesn't happen. First of all, any single ingredient, if you pick from all this list and you just have a belief ki okay, if I start taking fenugreek, 2 teaspoons of fenugreek seeds from today itself, and my insulin resistance will be completely reversed after a month or 2 months. It
Mm-hmm.
will not happen. It will not happen with any single ingredients because we now everybody know that there are so many multiple factors which are responsible. So you need lifestyle modification, you need stress management if it is there, you need dietary modification if your diet is not appropriate according to your condition and according to your disease. So we have to include these many things, we have to modify our diet, but we need to also keep in mind that any single factor will not work. Many people we know now who say कि हम तो daily exercise करते हैं, we do 2 hours of exercise in the gym and still I'm not able to lose weight. If I'm able to lose weight, I'm not able to reverse my diabetes or my metabolic metabolism is not good, my energy levels are not good. So you need to really ensure that you are targeting your root causes first.
Yeah. How about caffeine, Swati? If you've not touched too much of caffeine, do you think caffeine would be important to discuss with insulin resistance and diabetes?
Okay, so see, caffeine, man, nowadays it is something a trend going on with black coffee and caffeine. That and caffeine really, in a very mild to moderate quantity, it helps in loosening the fat, reducing the fat from the body. But if you're taking it in excess, then it has got more side effects than the benefits.
Especially people who are drinking first thing in the morning black coffee before going to the gym.
So, see, drinking coffee or tea, both the things first thing in the morning, it will eventually disturb your gut microbiota. It will just hamper your gut health. So, if you're not able to just avoid coffee or tea, you can have 1 cup of tea or coffee, but it has to be after your meals at least, and not
Eating
4 5 hours.
something and having it.
Because see, tea or caffeine, it will also prevent certain nutritional absorption in your body. So, what, for example, vitamin B12. If you are having good vitamin B12 rich food, and you're drinking tea or coffee after that, the absorption doesn't happen very well. If you're having
Yeah.
iron rich food, the absorption doesn't happen very well with caffeine. So, if you can limit or avoid caffeine, good. if you cannot avoid it completely, at least have very, very minimal and after your meals, not empty stomach at least. And not an expectation that 1 cup of coffee will just make you look like a
Yeah.
celebrity or model body.
True. Okay. Let's go to the next.
So we will quickly run because we already crossed the
Yeah.
time. So diet, I will just tell you all the thumb rules which you have to keep in mind if you want to help yourself or anyone in your family and friends. See, thumb rule with the insulin resistance or diabetes comes is number one is the low glycemic index food. Glycemic index is something which calculates the sugars released after the digestion of food. For example, a high glycemic food will release too much of sugar in your bloodstream. A low glycemic foods will comparatively release lesser sugar in your bloodstream after it gets digested. So I will give you an example of rice. Rice is a high GI food, high glycemic index food. When you eat only rice, then the blood sugar spike is huge. If you are eating spinach, then the blood sugar spike is minimal. So when you want to deal with this blood sugar spike, you need to ensure that you are majorly eating low glycemic index food, which is vegetables, whole fruits, whole grains, whole pulses, millets. These has to be included in a balanced condition. Portion control, definitely see carbohydrate and sugar needs to be reduced as much as possible. Fiber, inclusion of fiber is very, very important because it helps you in your gut health. It helps in reducing the glycemic load on your body. It helps in improving your overall digestion. And fiber you get from fruits and vegetables, which are highly rich in antioxidants, minerals, vitamins, which your body needs when you want to improve the functioning of your cells. Healthy fats, which you get from non-refined extra virgin oils, seeds, nuts, very, very essential for improving your liver health, for improving your heart health, and also to balance the glycemic load. Lean protein, which means the proteins which are not having too much of fat in it. You should be including lean protein in your diet. As at least 2 to 3 meals of lean protein is essential for anybody who want to reverse their insulin resistance.
Yeah.
Regular
Very
example, if you're eating a breakfast, heavy breakfast at 8 a.m. and then you're directly eating at 8 p.m., so this should not happen. You should be eating a regular meal around 5 6 hours. You should eat something so that you're maintaining a stable blood sugar level.
great. And then one of the most important thing is that people of the high and the low glycemic is like stop eating too much bread. It's a bowl of sugar. It's as equivalent to bowl of sugar. So one thing you want to really get rid of is that the bread, like even gluten-free bread, whatever bread you are having, just it is too much starch. And switch to whole foods, like whole foods, and instead of having bread as a breakfast, you could start having a lentil pancake or chila that has more minerals, vitamins, and of course, great protein, good source of protein.
Right. So this is what your, everyday meal should include. So many colors, variety of millets, grains, variety of pulses and lentils, variety of vegetables, fruits, nuts, seeds, everything. So all on a fair note, these should all be the part of your regular meals. Foods to avoid, as we already discussed, high processed food, trans fats, refined carbs, yes. So anything which increases the sugar load, anything which increases the glycemic load, anything which triggers inflammation has to be avoided or at least
So
reduced to a
refined oils, what you spoke about, the oils which people are having, canola, corn, they have very, very high
very.
trans fat, which you should really think what oils are you using, to switch to our oils. Like people are thinking seed oils and all, but
Yeah.
if you are using canola, if you're using these corn-based oils, which which will again disrupt a lot of things, and obviously cholesterol, lipid levels, and everything will high increase. So make sure that whatever you're using you should check them. Carbs, even sugary foods, like sugar foods, these are candies, cookies, everybody know. But do you know like most of the ref the like if you are suffering with insulin resistance, even having a little bit of jaggery, you should avoid that. Even what kind of jaggery? Now, I've just recently heard that a lot of jaggery makers are putting a lot of additives and colors to jaggery. So, switch what kind of jaggery you should have also should be very well selected, like date jaggery instead of palm jaggery and something like that. So, make sure that whatever you do it according to the best. Just don't do, okay, this is the best, this is the medium alternative. Go for the best, because there could be consequences.
Right.
People starting having fried chips and stuff, but now air fry. But air fry also has the all of a sudden it has so high temperatures that it can disrupt the nutrients of the food.
Reduce.
And obviously,
Yeah.
so just make sure that if you want to change to the best, not like a just don't compromise, I would say. Yeah.
Mm. Okay. So exercises, anybody, they need to start exercising under some guidance according to your body, according to your limits. But basic exercises which helps in insulin resistance are aerobic exercises, any kind of walk, swimming, cycling, strength training, and aerobic exercises. When you combine them both, it gives very good results in insulin resistance. And definitely other form of activities or physical activities and exercises, you're free to choose if your body permits you and your condition is applicable.
Right. Okay. So here are some case summaries. Now, 48 Haridas Kothawala is 82, I think is it. Okay, I was working with someone, obviously my Swati and Shwangi, we made a plan together. We would really understand. He's an 82 years old guy, Haridas Kothawala. He joined us, and the problem with he had a lot of sciatica problems, diabetes. He's been taking insulin over years. He has very poor immunity levels, and actually, I was working one on one with him, giving him exercises to do everything. So in 2 months, from the insulin level from 21, it he's only taking 11 now, and his gut has improved. He had also constipation, which also got better. So what we did was, obviously, we started giving him. I actually am quite strict with people. I told him no tea for some time because he was having gut dysbiosis majorly. We started him on these drinks, like really good green drinks. Supplementation is important at this age. I didn't tell him because he had done a few operations already, and we didn't reduce his medication, we only included supplements, lifestyle changes, because I was working personally one on one with him, like thrice a week, going to him, making him doing functional exercises, and really. And he lost weight. His pain is reduced. He's feeling lighter. He's been an inspiration, real inspiration. Yeah. Okay, next.
Right.
Now we'll take the questions right now.
Yeah. So
Yeah.
anybody
So what
discuss,
question?
ask,
Yeah.
or if you want to ask on behalf of your friends and family, you're free to do so because
Priya said I have abdominal fat.
yeah, if you want to talk about it, Priya.
Yeah, this is Priya.
Hi, Priya.
Actually, I am a breast cancer survivor. It has been 3 years. I am a ER positive breast cancer survivor. So I am taking under tamoxifen tablet. Okay.
Hmm.
So what happens is my abdominal fat is so big. When I ask my doctor, he says because of tamoxifen side effects, so you can't do anything with that. So I'm doing a lot of exercise, walking, whatever from my side, whatever I can do, I'm doing. But still, my abdominal fat is not reducing; it's little bit increasing. So what I can do for that?
See, abdominal fat. Since how many months or years have you been having, sir?
Like abdominal fat is, or even from my 20 years, I'm a little in obesity side only. So after my tablet, now I'm 36. I feel like it's a little bit more my abdominal fat
Right.
belly button.
Mhm. See, there is one thing called as visceral fat. Visceral fat is the fat which is present around your organs, you know. So, for example, your liver, your kidneys, you know, all the organs in your abdominal cavity. These organs, they usually doesn't have much fat around them. But if there is excessive visceral fat around the organs, it prevents the organ functioning.
Mm-hmm.
So we need to understand what kind of fat is more in your case specifically, because as I said, it has been years together, you know. So it might be quite possible that you have, you know, tried to reduce this fat, you tried with exercise or diet or maybe other things, you know. So if it is not going down, we need to understand if it is visceral fat. So visceral fat is very easy to detect. There are body composition analysis done. It is many gyms nowadays, they have a machine, you know, where
Yeah.
which
BMIs. Yeah.
in a minute, yeah, that if you have excessive visceral fat. So we want to understand if visceral fat is in excess in your condition, then the dietary protocol completely changes, because just reducing the calories doesn't work in excessive visceral fat cases. This
Mm-hmm.
fat is, it is very stubborn. You know, it's a different kind of fat. It doesn't go easily. So we need to work on inflammation, because inflammation can also be the cause of excessive visceral fat, and we need to maybe work on an anti-inflammatory protocol plus antioxidants as well, because antioxidants are the only potent molecules we can which can break down this strong bonds of visceral fat.
Okay.
True. And
Okay.
you know, tamoxifen has the side effects. It does
Mhm.
increase your insulin resistance because we've worked with a lot of people who are taking. So dietary modifications, as she said, and analyzing your BMI would give you a bigger picture and give
Mhm.
you a sense of what kind of how to hit it directly. So if you could
Okay.
go to the gym and just any gym, just get the BMI done, you will then we can obviously discuss more in details how and what you can do.
Okay. Okay.
Okay,
Thank
there's
you.
another question. I have been asked, Rajeshri, you can come on the screen if you want. I have been asked to avoid mangoes, bananas, chikus, grapes, and lychees because of high sugar content. Are you
Yeah.
diabetic?
Okay, fruits.
Okay.
You want to discuss about it, Rajeshri?
Breast cancer survivor. She's a
Right.
breast cancer survivor
Okay.
on tamoxifen. She's also on tamoxifen.
So good that you are avoiding these high GI fruits, Rajeshri, because they are high glycemic index fruits. But even when it comes to your grains and other things, you know, so some of the grains or some of the other
Yeah,
meals, so they have high GI food, especially the processed meals. They are almost all high GI foods. So that needs to be avoided as well, because
I
we
don't think so. For you
recommend.
should avoid for like that's what we like to do is a balance. If you want to eat, say for example, these foods also have a lot of other nutritional values,
Yeah.
grapes and chikus and bananas. Taking in a limited quantity and then taking care of the grain part, which is more high GI index, you can definitely have one mango or a few grapes and stuff, because fruits, no matter whatever they have high sugar content and stuff, but they also have good B vitamins and minerals and stuff, zinc and all that. So I would suggest do a balance, have a balanced meal. Don't get, these are natural foods, they're intent. We need a little bit of sugar in our diet. Good sugar. These are good sugars. What you need to avoid is the bad sugars, the processed sugars, the breads and the grains you maybe want. So one day if you want to have mangoes, you might want to reduce the high GI in your grains. I don't like to tell people don't eat all of these things,
Yeah.
especially fruits.
We never avoid any kind of fruit, any fruit from
Yeah.
any.
I hope it was okay. Any other questions? Anybody wants to come and ask questions? You are free to connect, free to ask questions. Otherwise, we're gonna wrap up soon. So I think I had a lot of messages going on my phone as well to share. I think there's a match which why people couldn't join today.
Yes, yes. Yeah.
Okay. But I hope the session was helpful. And if you want to get in touch with us, you know where to find us. You are all in the group, or you can WhatsApp, or you can email. And if you want us to work with you, you can obviously start working with a fabulous team. And we've gotten great results in few months' time with lot of people, a lot of people who have cancer are going through cancer after cancer. Also, we've done a lot of detox programs with them to avoid a relapse. And we are, Swati and Shivangi both are masters in taking care of obesity. I worked with so many clients here in US who are obese, who have diabetes, who have thyroid, and really we've reversed people's, and they were so shocked and astonished. So definitely, if there is a way, there is a will, there is always a path, a holistic path, and that I feel function ho gaya, ye ho gaya, but holistic where you include your mind, body, soul, spirit, everything together to keep yourself healthy. And most importantly, your body is like a vehicle. It's a beautiful machine given us by Almighty, and we should keep it optimally to not only work, to function, but also to be an example. I feel cancer obviously changed my life, and I understood so many perspectives of health. And I feel that you are responsible for your own health, and you should. And thanks for joining in. You should have proper knowledge and wisdom to carry forward. One healthy person makes four other people healthy in your vicinity, in your community, in your family. So thanks for joining and really and making this a good, fun, interactive webinar. Really, really grateful to all of you who have joined in. And we are going to get more and more sessions. If you have any feedbacks, if you want to understand more, if you want us to come up with different topics, we'll be glad to hear about them. And we'll be preparing for our next topics. Next topics, Swati, what are the next coming up topics which we have discussed?
So we have also, shortlisted few topics, and one is about the metabolic disorders, and one is about the liver health. One is about the gut health, which is also a crucial topic to be discussed. And if somebody wants to understand in detail about insulin resistance, we can have an advanced session on this as well. If anybody who is suffering already with this, and we also planning a webinar on label reading, because nowadays in
Yes.
market, so many products are available, and everybody wonders ki, okay, what to eat, what not to eat, written herbal, what to understand. So how to read your labels, how to identify what product is okay, what product is has to be discarded. We can have a webinar on that as well, so that you are pretty clear about how to choose products by your own. You're empowered yourself.
Yeah. Okay. And thank you, Swati Shivangi, for arranging this. I think it was a very nice webinar. And yeah, thank you all for joining. Thank you so much.
Thank you, everyone.
Thank you.